Our next healthcare expert will guide you through the digital patient engagement models, reflect on where the healthcare industry is going in conditions of internet economy, deliver the key elements of a unified patient engagement platform, and even show how it works. Hi, Mark. The audience is all yours.
Thank you very much. Hi, my name is Mark Boudreau. I'm from Healthfully. I also have Josh Fuller, who's our Director of Client Services. He's going to join us and actually give you a demo of what unified digital patient engagement looks like and its role in digital healthcare transformation. So I'll just present a few slides on, what is unified digital patient engagement and what are some of the advantages and where we see the marketplace going. So when you look at patient engagement, this is the health system engaging patients. There's a couple of models out there. I mean, in years past, we used to have this what we would call a digital facade, which was really just a website where patients would go to see the services they could get. But if they really wanted to engage in the services, it would be, a phone call that they would have to do, or it would be some terse, web form that they would need to fill out. Then there was this whole trend of digital front doors that, again, for the most part, and it were initiated through websites, and all of a sudden more services were exposed to the patient through those websites. But they, for the most part, they were different links to, different EMRs, whether it was the hospital EMR or whether it was the, ambulatory services EMR for primary care, et cetera, or it was a specialty service EMR for something like behavior health, for example. All these EMRs have their own portals, and you'd have to access them through different links. And the user experience was different, and all of the patient data was stored in those links separately, and you couldn't see everything together. And then in terms of getting care, it was very limited. You could maybe schedule a visit, you could, do med refills, but that was kind of the limit of, digital delivery of care. And the model that we're seeing today is what we call unified patient consumer engagement. And it's like an all-in-one platform from the patient's perspective. So they have one way of getting access to care. They have one way of choosing all of the care that they need across disparate care settings. The look and feel of the solution is the same, no matter whether they're dealing with the hospital, primary care, or behavior health. They can see all of their data in one place. And they can actually participate in the delivery of care. So the digital tool there is about getting the complete job done that the patient is looking to get done. Like, the patient's not just looking to book a meeting, they're actually looking to receive and solve a particular problem. So that's where we see things today. Why now? Why is patient engagement such a big thing happening today? Well, first of all, healthcare tends to lag other businesses, other industries and other businesses. You take a look at online retail, pretty far advanced, banking. These technologies have been well adapted by consumers a while ago, but it is inevitable that healthcare will exist within the internet economy, and COVID has helped act as a catalyst to accelerate that, but it is coming. There's also a continuous line of new forms of care, and when I say that, it's ongoing care outside of the hospital. So things like value-based care, RPM, hospital in the home, or social determinants of health management. These are all forms of ongoing care that require extensive patient engagement to be successful, right? This is not something that you could do from an efficiency perspective through the phone and constantly having the patient come in for an in-person visit. This is something that definitely needs an extensive solution. And then you have the rise of online health services only. These are services that don't have any bricks and mortar, that have managed to expand nationally really quick. And, the ones that come to mind are urgent care, virtual urgent care, for example. There's quite a few services that have popped up nationally. The other one since COVID that's really stuck and expanded is behavioral health. Apparently both providers and patients don't want to go into an office for mental health consultation. So that experience is continuing. And for those organizations to deliver care completely online and be competitive, they really need an end-to-end solution that covers that total digital experience, and it needs to be a premium experience. And then you have new entrants that are really setting the bar in terms of digital expectations industry-wide. So some of you may have heard just recently that Amazon Prime just announced that Prime members for $9 a month can get access to Amazon's One Medical services, which are doctors available virtually and also in clinics, but you get unlimited access to virtual care for $9 a month. That has a big impact on the industry. And then there's other forward-thinking technology firms out there, like Teladoc's been in this space. 98.6 is another organization that's delivering care online. Anyways, these are having big, wide expectations in terms of what unified or all-in-one patient engagement is all about. And then you have, patient demand for more convenient experience like they receive in the retail space. You look at Amazon, you can order your product, pay for your product, get it delivered to your house all in one platform, right? And these forces are really having an impact on the technology industry today. So there's a industry-wide technology convergence happening, and it is a convergence towards this unified patient engagement concept. So if you look at all the different types of patient engagement technology, you have everything from patient CRM all the way down to, well-being reward solutions. And if you look at that today, you can see that some of the televideo vendors are expanding laterally and are getting into secure messaging, for example. And you have secure messaging organizations getting into patient registration. So the industry acknowledges the technology advantages, the cost advantages, and the convenience for patients of this, unified patient engagement, of having the complete end-to-end process solved in one solution. So there's this convergence towards that unified patient engagement platform. And that's not always easy because the architecture really needs to support that concept. And so some of these companies are going to have to, start from scratch from an architectural perspective to really fulfill a unified patient engagement platform. And from the organization or the health system perspective, there is definitely, a value side to this. Obviously there's cost reduction, revenue generation, improved clinical outcomes that come into play with better ongoing care management and digital engagement. But when you look at it from a broad strategic perspective, you could see that most health organizations are still in this far left corner here where they provide isolated functionality, right? They have multiple apps and multiple app owners within the organization. For example, they'll have a patient portal solution for their EMR for the hospital, a different patient portal solution for ambulatory care and behavior health and whatnot, right? The next step is what we're talking about today, which is that unified patient engagement, where you have one, solution for the complete end-to-end experience, from registration to care delivery. You have one app owner in the organization, and you have one digital patient experience. And if you can create that, then as a health organization, you have lots of options. One of them is to do a tried and true shared services operation where you say, okay, we're going to have one very efficient patient engagement platform that include care workers, the technology, and the new processes. And that shared service will service all of our primary care clinics, for example, in this health system. So I'll deliver, let's say, my RPM program through one shared service, and I'll offer it for all of my billing providers that are in the primary care clinics, for example. And you can see where you can get some huge savings and some real consistency of services and brand offering for the health system. And then, of course, you can move right up to the top right-hand corner with profit centers. And, a lot of the online service organizations that we see exist there, the patient engagement and ongoing care that they offer is all part of the profit center for them. And you can see where if you get really good at delivering shared services, then the shared services within your organization becomes a profit center, and you can start getting into things that generate revenue like RPM and whatnot, hospital in the home. And if you get really good at it, not only can you provide these services for your own health organization, but you can offer it to others. When we look at the architecture for unified patient engagement from a high level perspective, you can see the end-to-end nature of this. It includes everything from self-intake registration to scheduling and appointments to payments and different forms of communication, embedded in the solution, whether it's synchronous or asynchronous. So you can have secure messaging, you can have, telehealth, you can have moderated communities. There's lots of forms of communicating and engaging the patient. And then, of course, you have, the patient has one unified patient record, right? It's all in one place. It's expanded to include patient-generated information, your RPM data, and all of the different patient portal information they may have collected. And then for health and wellness solutions, you provide the tool set to manage that ongoing engagement with the patient. So whether it's notes, prescribed orders, visit summaries, referrals, creating care plans, and coordinating community plans, it's all within that patient engagement solution. And, it's important to note here that, 80% of the patient engagement is happening with resources or clinicians that aren't physicians, right? So these are everyday care managers that are having the daily engagement with patients. So you want to make sure that they have a tool set that goes beyond what's provided in an EMR. And then, of course, you need to be able to manage the various services, whether it's chronic disease programs, various care coordination programs, concierge services, smart screens, all those tools that make up the workflow of the care that you're offering. Then, of course, the analytics and BI need to be behind that. And you need to be able to integrate, of course, with the EMR and the enterprise systems within the health solutions so that patient engagement is truly, transparent. And then in terms of the consumer channels you serve, you need to be where the customers are, right? And so generically available on the web, it should be branded so the customer knows who they're dealing with. You need, for more intense experiences and younger audiences, they're going to expect everything to be in the app store. So you need native apps that take full advantage of the devices. You need to have kiosks for those that may not have access devices but want to access a device in a pharmacy, in a school, or at employers' locations. And providing medical grade devices to integrate with the platform to allow hospital in the home or RPM solutions. You need to provide the same channels for providers, and you need to be able to have third-party online services be able to connect into the system as well. So that in a nutshell is what unified patient engagement looks like, and that all-in-one solution that is all part of digital health transformation. And from there, what I'm going to do is that I'm going to pass it to Josh so you can actually see what a unified patient experience looks like.
Succinctly, we'll talk about the stuff that Mark referred to. So we provide a branded experience, which is something that everybody is looking for. They're looking for their brand across the enterprise to be unified and shown out to their consumers. So you see some of our sample brands here. And we typically see people using the native offering just because it provides the most seamless experience. In the application itself, you will find a truly unified platform. So you'll see these little tiles at the top. It gives the consumer the ability to control everybody that they care for. Instead of having to sign into the portal for your account, sign out, and sign into your daughter, for example, you get one unified platform to quickly toggle between the different people that you care for. And you'll see that throughout the demonstration. In the to-do section, this home screen is really all the transactions that might occur in an enterprise. So everything from you have an upcoming appointment, here's all your forms that need to be done from start to finish. And then once the visit happens, we're prompting you for a Google review or a satisfaction survey to see how the services were that were rendered. So asking patients to fill out clinical assessments, things with e-signatures, free text responses, numerical values, device data, whatever the source or the response that is needed, the platform will ingest and not only store that data, report out on it, but also trigger workflow. So send alerts to providers as something is out of range, send that data back to the source record so you don't have to have a piece of paper that you scan into the EMR. So really creating not only the cohesive experience for the patients, but also in the office so they don't have to sit there and do administrative work that we can automate through the integration and through the platform itself. We supplement all this with push text and email notifications. So meet the patient where they are. So you have a new form to complete. Let's send you a prompt through your preferred channel. You have an upcoming appointment. Let's prompt you to pay for your copay. Let's prompt you to complete all the forms you have to do. Let's prompt you to have a telehealth visit. So let's use proprietary software that looks like it's coming from the branded application. And let's have them have that digital experience within on their device from where they are instead of having to come into the office itself. So really providing that unified experience. And with this, with what we see in healthcare, like Mark said, stuff is coming from multiple different systems. So to the patient, we don't know if it's coming from Cerner, we don't know if it's coming from Epic, we don't know if it's coming from Athena, but that doesn't matter to us. We just want one place to do everything that we need. And same thing for scheduling. We want to provide the patient with a unified scheduling experience where when they get to where they want to go, it doesn't matter what system that this is going back into. So let's curate the service destination where the patient is making selections, prompting people, putting in information that we can then reach into the source system and say, okay, this person needs to be seen for a sick visit. Here's all the providers that are available for that, regardless of the system that they're working in. So again, you might have an outpatient EMR, you might have an inpatient one. We're going to allow the patient to schedule on both of those and use the platform's intelligence to know exactly what system that needs to go back into. So really handling those transactions from a seamless experience, and then transforming healthcare by the bottom bar, where we have the health board, which is our unified patient portal with a holistic health record on top of it. So connected device data plus all of the various clinical sources. So the consumer gets access not only to themselves, their loved ones, but all of the different sources instead of having to reference multiple systems to get a full picture of their health. So looking at my Apple Watch, for example, looking at connected blood pressure devices, trending that data over time, providing them with a very clean UI has been critical because patients from different technical acuities, we want to give them a seamless experience that they don't have to ask questions on how it works. So interfacing with the medical records, bringing in data and unifying it back to the consumer. So I want to see my medications. I want to see my lab and test results. I want to trend my results over a period of time. So let me see all of my hemoglobin and see that data on a easy to consume graph instead of having to pick one by one to see what all of my total values are. And all of that data. I won't go through all of these, but taking whatever source and data we need, whether it's discrete data all the way down to PDFs and documents, and providing that back to the consumer. So that lets them access their data, but if they need to ask questions, let's provide them with a unified messaging platform that lets them not only text with providers, but also make phone calls, also attach videos, to attach photos. So everything from asynchronous communication with the office staff and the provider, but also providing things such as wound care, calling a provider, having that run through the platform and turning that directly into a telehealth conference. So taking all the functionality people are accustomed to in the platform.
We're experiencing some technical difficulties, but the things that we've already seen are just amazing. Mark, would you be able to proceed with the closing notes on the presentation of Josh?
Yeah, okay. Yeah, thanks. It's too bad, I guess we have multiple presentation devices here that the mic turned off, as you can. But anyways, thank you very much for joining us today. I think you get a sense of what, a unified patient engagement solution is all about and what the advantages of it. Obviously, if there's any more questions, feel free to, reach out to the folks here or myself at any time.
Yeah, we actually have a set of questions for you and for the presentation that you've provided. If you don't mind, I will just share those questions so that you could answer them.
Okay.
Just a moment. Wow, so many of them here. Just a moment. Uh, yeah, let's start with the first one. Uh, Love the app Josh is demonstrating. Oh, it's probably during the demonstration. Is this solution custom built?
Yeah, it's we developed it since it's been 7 years now, so it's a very mature product, and it is deployed as a software as a service solution. So it's a typical SaaS solution. We do offer some customization. So if a client has a specific integration that we haven't already done, or that they want to add a specific capability, our company is able to have specific customizations by client. Our solution is architected to handle that. But yeah, it's built by us. It's finished, and it's in production with a number of clients.
That's great. Thank you so much. Another one for you. The demo was fantastic. That's something totally new here in Europe, but seems well suited for it. Is your operation currently limited to the US, or do you have plans to expand into other markets?
Yeah, we certainly have plans to expand in other markets. What defines, the solution is where the data is stored, right? And we have an advantage that we use AWS for actually hosting of our application on. So all of the underlying infrastructure is AWS. Right now, the solution is hosted in North America, in fact, on the east coast of the US. But the whole solution can be transported into other jurisdictions around the world. We would just have to create another AWS infrastructure for that region. So if we're going into Europe, we need another AWS install in Europe, and we just port the entire solution that we already have developed into that that marketplace. So it's not a big deal. We have had interest from European players, and we continue to have those conversations, and we're getting closer and closer. And pretty soon that infrastructure will be established.
That's great. Thank you so much for the answer. I guess I have a question about the solutions that Josh was demonstrating. I mean, the demo of the products themselves. What integration protocols do these apps utilize?
Yeah, uh, so we integrate mostly with electronic health records or EMRs. And most EMRs will have a set of APIs as defined by the 21st Century Cures Act, the Portability Act. Patients should have the ability to bring their data to any application they choose. So we have developed integrations with a number of EMR vendors already using those capabilities. We also, as individuals, have been involved in creating, various integration engines. So our solution has an integration engine, so we can, handle Fire, HL7, and all of the other components. So it allows us to integrate with just about any health system out there.
That's amazing. And it's really agile and flexible at the same time, along with the scalability. That's great. Thank you. We have one more question here. Thank you for your presentation, Mark. Do you mean to say that being a more digitized healthcare business leads to better expansion opportunities?
Yeah, I think so. And this is just what we're seeing in the marketplace. So there are health services out there that have decided that they're only going to deliver their services virtually, that they're not going to have any bricks and mortar or physical buildings. And what we've seen is we've seen them have the ability to grow much faster than organizations that need to build a lot of infrastructure or at least acquire a lot of infrastructure. So if you have a practice that likes, working from home and would like to expand nationally and leverage existing clinics that are already out there, then yeah, that's a recipe for growth. You see, what's happening with Amazon right now. It's just unbelievable how a technology company is getting into the healthcare business.
That's great. Thank you so much. We actually have a couple more questions, but I think that these are not the only ones we have to answer, but we're pressed for time, so we will be redirecting those questions later on. I just wanted to thank you so much, Mark and Josh, as well, for the presentation and the live demo of the product.